Hello, everyone. Welcome to the Language Access webinar. We're going to first, before we start, to select your language. Would the Edna and other interpreter provide some instructions?
Yes, thank you, Eddie. Hello, everyone. This is Edna Santizo, and I'm going to be one of the interpreters today, together with my colleague, Julie Young. I'm going to be providing instructions on how to access interpretation. I'll do that first in Spanish, and then I'll follow in English. Buenos días a todos, soy Edna Santizo y junto con mi colega Julie Young estaremos interpretando esta sesión simultáneamente. En un segundito van a ver en la parte baja de su pantalla, si está en una computadora, un icono que dice interpretación. Cuando aparezca, por favor, presione y seleccione el idioma de su preferencia, ya sea inglés o español, y también mute original audio o silenciar el audio original. Si está en un teléfono o en una tableta, va a haber 3 puntos en la parte baja y va a presionar ahí, después presiona Language Interpretation, después selecciona el idioma de su preferencia y también Mute Original Audio. Si por cualquier motivo tiene problemas con esa función, siempre puedes regresar ahí y seleccionar Mute Original Audio o acudir a nosotros a través del chat para asistencia técnica. Gracias. So hello everyone. In just a second, we're gonna enable the interpretation function. If you're on a computer, you're gonna see at the bottom an icon that appears that says interpretation. Once it's there, click and select the language of your preference, either English or Spanish, and also mute the original audio. If you're on a mobile device or a tablet, you're gonna see 3 dots either on top or the bottom of your screen. Click, select language interpretation, then the language of your preference, and also mute original audio. If for any reasons you're having issues with that function, you can always go back and unmute the original audio. And if you need technical assistance, you can reach out to us via the chat. Thank you.
Thank you, Edna. Just want to make sure folks to pick your audio. Well, hi, welcome everybody. Welcome to the Language Access 101 requirement, best practice, and resources for working with persons with limited English proficiency, LEP. Training. The training is hosted in partnership with Asian Resources, the Children's Partnership, API for Movement, Legal Aid Foundation of Los Angeles, PALS for Health, and the California Protecting Immigrant Families. My name is Eddie Hu. I'm the Associate Policy Director at Asian Resources LA office. I will be your moderator for this training webinar, along with my colleague Andrew, who will help monitor the chat, and Monique from the Children's Partnership, who will assist with any tech issues. So if you have any tech issues, please let us know and put them in the chat. We're very happy to have you here with us. Please feel free to introduce yourself, like Oscar type in the chat, and share your name, your title, your organization, the area where you work or located, and tell us one thing you're looking forward to learning during this training. In the next 90 minutes training, we will invite language access experts to share their knowledge with you. First, we'll go over some quick housekeeping for the training session. You can go to the next slide. So the training, it will be recorded. By staying on this Zoom webinar, you're consenting that you can be recorded, and we will share the recording and the slide after the training. If you're not speaking, please make sure to mute yourself. And we always suggest folks to minimize your distractions by either going to a quiet space to possible, or silencing your phone and closing extra browser tab, or just have Zoom open. There are multiple times that we can do Q&A. So raise your hands when the Q&A session happens, or type your question in the chat during the Q&A session or anytime during the webinar. And we also would like to receive your feedback at the end of the training. There will be a survey with the link. So we hope that you can provide some feedback to us. Next slide, please. So the Q&A function is relatively easy. You should be able to see a Q&A little question box at the toolbar at the bottom. Submit your questions using the Q&A function, and we will document all the questions and the answer on a spreadsheet as well as also in the Q&A, and we will send out any questions that were asked and answered after the session. Next slide, please. And the agenda for the training, for the 90-minute training is as follows. We're going to quickly do an introduction of the training objective, going into language access requirement, sharing some language access services and best practices, as well as what language access look like in different settings. We also want to talk to you about language access advocacy. There will be Q&A session in between different sessions. And lastly, we'll have language access resource roundup and also help for all resources and evaluation and wrap up. Next slide. Yeah, some quick training objective for today is to understand the legal requirement and policy as well as the language access resources available for people with LEP and learn how to meet language access requirement, best practices, and bridge language gap in community services. Gain knowledge on how to work with interpreters and translators, understand how to advocate address language needs in community with LEP. Next slide, please. Here are our language access experts. They will be the speaker in different sessions. First, we have Dorina Wong, our policy director at ARI, and we have Media Munoz at program director at Pals for Health, and Joanne H. Lee, special counsel on language access on Legal Aids Foundation of Los Angeles. Hang Lam Fong for a co-director for API4 movement, and Oscar Sandoval, manager of community engagement and advocacy research and education at the Children's Partnership. So before we go into the training, we want to provide you with some language data to give you a better understanding of why language access is important. And this information will provide useful background information as we begin the language access training. Last slide, please. Here are some background demographic on the national level. According to the US Census estimate, approximately 68 million people in the United States speak a language other than English at home. Of this group, around 8.2% are considered LEP. What that means is they speak English less than very well. And additionally, according to 2019 US Census, top languages spoken in US other than English are Spanish, Chinese, Mandarin, or Cantonese, Vietnamese, Tagalog, and Arabic. Next slide, please. And here is some data on the top language group with LEP according to the 2022 American Community Surveys. And these are the California stats. The stat might be a little bit small, so we listed them out at the second box to let you know. So we have, California is one of the most diverse populations in the country, with residents who speak over 200 languages, variant, dialect, and we have the largest LEP population. 44% of the population speak a language other than English at home, with almost 20% of population with LEP. So that's almost 6.4 million Californians. Most of the LEP households speak Spanish, followed by Asian and Pacific Islander languages, such as Chinese, Vietnamese, Tagalog, and Korean. And for Asian and Asian Americans, the LEP percentage is closer to 33%, with different ranges of over 50% for Burmese, Vietnamese, Nepalese Americans, more than 40% of Thai, Chinese, and Korean Americans, and to around 20% Filipino, Japanese, and Indian American. As you can see, language barrier presents a significant challenge for individuals with LEP, impacting their ability to access quality healthcare coverage and service effectively. Next slide, please. We would also want to highlight LA is home to diverse population of indigenous immigrants from Latin America. Their languages are often left out of official data, according to the California Rural Legal Assistance, CRLA. Many indigenous languages have dozens of different language variant, community of origin, with hometown with limited mutual intelligibility. Many of the indigenous language have formal written form. However, most in indigenous America and California do not read or write in their indigenous languages. Many indigenous interpreter also work between Spanish and the indigenous language as not proficient in English. Next slide, please. So hopefully you have a better understanding of the language data landscape at the both national and California level. I would like to introduce Zarina from ARI. So she will share her expertise on language access requirement at the federal, state, and local level with you.
Thank you, Eddie. Before I get started, just a couple of caveats about my presentation. First, I'll be focusing most of my comments on language access for persons with limited English proficiency, or LEP, rather than people with disabilities, and primarily related to healthcare settings. The other requirements for different settings will be covered later on in our webinar by Joanne Lee. Second, I won't be able in this limited time to cover all of the legal requirements related to language access, but hope to just provide you the type of language assistance you should expect when seeking healthcare services. Go ahead with the next slide, please. And so as Eddie shared, for the nearly 6.4 million Californians that have LEP, language barriers pose a huge challenge to their ability to access quality healthcare services. Studies have documented that there's many health disparities and adverse experiences that LEP individuals face during provider visits and with healthcare systems due to the lack of culturally and linguistically appropriate healthcare services. For example, inadequate language services have resulted in longer hospital stays, higher likelihood of hospital readmissions for LEP persons, as well as difficulties understanding instructions for follow-up treatments and medications. And these are avoidable costs that can be significantly reduced with improved language assistance services like interpreting and translation services. So that's why language access is so important. So let's just look at some key facts about language access. The requirements and policies help make sure that LEP individuals can receive the services and information without being discriminated against because of their national origin, which has been interpreted to mean also discrimination based on language. So Eddie gave you a little definition of what an LEP person is in terms of the data, but it also means a person who does not speak English, does not speak English as their primary language and also has a limited ability to read, write, speak, or understand English. So these laws are meant to protect anyone with limited English proficiency, regardless of immigration status, country of origin, age, or health insurance status. So the most common federal, next slide, please. So the most common or well-known federal requirement supporting language access is Title VI of the 1964 Civil Rights Act. So let me share first what ensuring meaningful access to programs and services is not. It's not providing more limited services or lower quality of care. It's not delaying the delivery of services. That is, like if you go in for an appointment, somebody says, oh, we don't have an interpreter, come back later. That is not meaningful access. It's not limiting participation in a program, and it's not requiring an LEP person to bring their own interpreter or pay for one. So what it does mean is that the entity, the organization or healthcare provider has to provide what we call reasonable steps to ensure meaningful access to its programs and services. It's not definitive what those reasonable steps are, but there are different factors to consider. It's kind of like a balancing test. There's different factors like the number and the percentage of LEP individuals that are likely to be served, how often, the frequency of contact, how often are these LEP populations being served, the nature and importance of the services or the scope of the program, and then also what resources does the entity have, or what's the cost of providing those services. Now, I said that, this test has changed over the years. It used to be these factors, but it's been modified somewhat by a recent regulation, Section 1557 of the Affordable Care Act, which broadens the number of factors that you can consider. So it says that you should evaluate and give substantial weight now to the nature and importance of the healthcare program or activity and the particular communication at issue for the LEP person. For instance, if it's really an urgent case or you need the services immediately. And then you can consider other factors, like those factors that I just went over, or you can also look at the effectiveness of the covered entity's written language access procedures. Next slide, please. So, who is required to provide language access? Well, under Title VI, it's any federal, state, or local government agency that receives any federal funds for any of its programs to run that particular program. So it includes a lot of public benefit programs like Medi-Cal, CalFresh, CalWORKS, WIC, or Section 8. Now, in California, we have some specific requirements because the state has long recognized the importance of providing language assistance services and, specifically addressing access for LEP individuals. So we have a government code section that is also a similar anti-discrimination statute, similar to Title VI. So it says that any state agency or any state-funded agency and local agency or entity that receives funding from the state and provides services is also covered under this language access requirement, such as Department of Healthcare Services, Department of Social Services, and local county health departments or departments of public health. Now, some of these laws also apply to healthcare facilities and healthcare providers like hospitals, health centers, or clinics, pharmacies, doctors' offices, or rehab centers, anyone that is under the Medi-Cal and Medicare program and bills for those services. And then finally, there are also requirements for entities that provide health coverage, such as health insurance companies, managed care plans, and health insurance marketplaces, like in California, Covered California. Next slide, please. So what does language access mean specifically? So Title VI and its regulations aren't really specific, but they did issue a guidance that, as I said, it's guidance. It describes some of the requirements that different federally funded agencies are supposed to provide. So it's to provide competent interpretation services. And what we mean by competent interpretation services means that the interpreters should be trained. They should be proficient in English and their non-English language. They should understand their code of ethics and the role of the interpreter. So in most cases, it means that the interpreter should be provided for most LEP populations, unless it's a very rare language, because these days an entity can contract with a telephone interpreter agency that covers hundreds of languages. It is also supposed to provide, in terms of the use of interpreters, it also requires that you must not use family or friends or minor children or untrained interpreters. And so only in cases of emergencies and until an interpreter can be found. And then they're also supposed to provide competent written translations of vital documents. Now, what are vital documents? It's documents that have important information in there, in the document, that maybe affects somebody's legal rights and obligations, such as application forms, notices, intake or consent forms, discharge instructions, medication labels. And so it describes what examples of what vital documents are. It also does not describe specifically prescribe what languages those vital documents should be translated into, but it does provide what we call a safe harbor, so that if for those LEP populations that meet 5% or 1,000 in the service area of the entity, and you translate the materials in that language, you can be assured that you probably are in compliance with Title VI. And then in terms of, if it's a small population, say it's under 50 LEP individuals, you can provide oral interpretation of the written materials free of cost. Now, another requirement is that you have to provide notice of the availability of free language assistance services, both interpreter services and translation services. And again, maybe there's posting notices in public places, posting it on your website, posting it anywhere where the public would want to know about these free services. And again, Title VI does not describe, what languages those notices are supposed to be translated into. But again, that Section 1557, the new regulation, has said that it should be at least in the top 15 languages of the state. Also, the entity should have an effective language access plan that should be reviewed and monitored at least annually. I'll go into that in just a moment, what a language access plan should have. And then finally, when you're thinking about, well, in terms of enforcing Title VI, who enforces these different requirements? And that would be under HHS and for Health and Human Services agencies, that would be the Office for Civil Rights, where you can file an administrative complaint. And we will go into that a little later in the webinar. Next slide. Now, there are some state requirements that provide even more guidance than Title VI. I told you that California has a lot of different rules and regulations. Now, I can't go through all of them, but I'm going to just highlight a few of them that I think might be relevant. As I said, the Government Code 10135, the anti-discrimination statute, basically says that the state programs and state-funded entities should be able to provide interpreter services if they're open 24 hours, then, for all hours during the business when they're open at all points of contact, free of charge. And then, as I said, these days, a lot of agencies can contract with telephone language lines and provide services during the business hours. Now, there's another statute that requires that a sufficient number of qualified bilingual persons in public contact positions and should translate materials for LEP populations that meet a 5% threshold. And that 5% threshold has been interpreted, to be applied statewide. So at the moment, the only language that is covered under the Daimele Aleatory Bilingual Services Act is Spanish. And we hope that we could, it's an advocacy opportunity, that we might be able to cover more languages if we can amend that particular requirement. Next slide, please. So if we look at other state requirements, there's the COP Act that requires all acute care hospitals to provide language assistance services 24 hours a day for language groups that meet their 5% of its service population. There is a little loophole in here where it says to the extent possible. So sometimes the hospital might say it cannot afford to provide these services, although we would argue that at this day and age, they should be able to provide interpreter service and translated materials to some extent. It also has to develop the policies, just similar to the other requirements and post notices about the policies, about language assistance services, and identify and record the patient's primary languages in the hospital records. I also wanted to point out that managed care plans also have requirements, both private managed care plans and in the Medi-Cal program have to provide LEP persons on a 24-hour basis at the key points of contact, public points of contact, free of cost. And then translation of materials, vital documents into certain languages. For instance, in the Medi-Cal program, because there's some specific threshold standards, both for standard languages and certain concentration languages. Now there's 18 languages covered for Medi-Cal beneficiaries. Now, not all counties have to provide all of the vital documents in all 18 languages, but depending on if it meets those particular thresholds, then it must provide those languages, translate those materials in that language. Okay, next slide. So I had referred to the what an effective language access plan is, and the Federal Health and Human Services Agency has updated its language access plan and the elements of an effective language access plan last year. And so all of these elements, these 10 elements, actually the 10th one applies to its federally funded entities. But all of these other elements apply to any effective language access plan. I can't go into all of them. I think a lot of them are pretty self-evident. For instance, the assessment, the entity has to assess what the needs of the language needs of the service population. What are the language that the population needs are? And then interpretation services, written translation, what are the vital documents? What languages should it be provided in? And then they should have a written policy and procedures to make sure that it includes all of these different aspects. The staff has to be trained so they understand the language assistance services and procedures. And then in terms of digital information, I did just want to point out that in terms of providing the use of machine translations and use of artificial intelligence applications like Google Translate, they have to be verified by a qualified human translator before the content is approved. Next slide. So I am having to go through pretty quickly the rest of the slides, but I did want to just provide examples of different efforts to increase language access for LEP persons. First, for the California Health and Human Services Agencies, Cal HHS, I mentioned that it has a policy that was a result of an executive order by the governor to ensure increased language access. As you can see, it requires each of its agencies to have a language access plan and provide interpreter services at all public points of contact and translate all vital documents, including essential public website information in the top 5 languages and an American Sign Language in the state. And then finally, I won't go into, next slide, please. The recent local mandates. In the city of Los Angeles, they also issued a citywide language access plan. And as you can see, you can go back and see that it requires each city department to have its own language access plan. And the city language access coordinator, which is an agency, the Community Investment for Families Department, CIFD, oversees it. We've been working with CIFD. There's a LA Language Justice Coalition of advocates who are meeting regularly with that agency. And then finally, just the county of, LA has done a similar effort where the County Board of Supervisors passed a motion to strengthen language access to its county services and requires all of its county agencies to issue a language access plan. And the Language Justice Coalition is also monitoring and working with the Office of Immigrant Affairs that's monitoring the implementation of this language access plan. So I'm sorry that I had to rush through all of this. I apologize. I hope it was clear. I think, if we can take maybe a question. I'm going to, next slide.
One more slide.
This is for questions.
Yes, yeah. If folks have, feel free to unmute or use the Q&A. There is happy to answer any of your questions if you have one or two. So far, there's none in chat.
Okay, we can also do it at the end.
Yes, we will. Hi, Dave. We will provide the recording and slides. Yeah, maybe we can move on. And since we don't have question right now, maybe you have some later. I will invite Mireya Munoz from Pals for Help to talk about the language access services, interpretation and translation. Hi, Mireya.
Thank you, Eddie. Great, yeah, so definitely. So thank you so much for the opportunity. So when we talk about language access, and thank you, Dorina, for that wonderful information introduction. We talk about interpretation and translation services. So when we talk about the delivery of that, we typically, if we can go to the next slide, we're talking about interpretation and translation services. And these are delivered typically by translators and interpreters. And a lot of times our communities get these two terms confused. So we'd always like to make sure that we clarify that these are two different distinct roles that individuals carry out. So when we talk about translators, we're talking about the written text. So translators, their job is to translate the written word or the written text, usually referring to books, documents, contracts, websites, anything that has to do with the written or the written text. While interpreters, their task is to transmit the spoken or the signed language. These typically work in healthcare settings, for example, during medical appointments, or mental health settings, court proceedings, or even conferences, or even in this case, we have the wonderful interpreters that are helping transmit the message during this presentation as well that we have here. So, always time, like I said, we always want to make sure that we give credit to the various tasks that are required to deliver the message in the various forums or different modes of delivering the words that are our audiences are able to hear. Excuse me. Next slide. And we know that, depending on the mode that is utilized, right, we have different roles that are carried out. So typically this is carried out by, most of the time by bilingual staff that, is tasked with this role. And usually bilingual staff, these are individuals that, speak more than one language, which typically is what we see in a lot of our our communities, right? These are the individuals that are this task is put on them to be able to help our communities communicate with the world around them. And we know that translators, again, like I mentioned before, their job is to convert the written text from one language into another, and interpreters, their job or their role is to convey the spoken or the sign language from one, the message from one language into another as well. Okay, next slide. So one of the things that, at Pals for Health and us as language advocates, one of the things that we really like to emphasize is really trying to emphasize of creating an environment in which, our LEP, our limited English proficient, communities feel a welcoming environment. And, and one of the ways in doing that, again, is to really ensure that they are, making a safe space and a welcoming space for them to know that regardless of the language that they speak and the spaces that they enter, that they are welcomed, right? And that, us as service providers are making every effort possible to ensure that we are there to service them, and that we are going to make every effort possible to be able to communicate with them in the language that they feel most comfortable in. And that starts by, again, making an environment that speaks to them, right? By providing signage, words that, that speak to them, right? By, again, posting a signage, or posters in the lobbies, right, where they enter in their language that's, that speaks to them and tells them, hey, look, interpreting services are available to you in these languages. And most important of all, that they are available, like Dorina said earlier, free of charge. A lot of our communities still feel that they have to pay for those services. And many times they hold back and they won't ask for those services because they feel that they will be charged for them, or that they are responsible for bringing somebody from their family members or from their community to come help them with that process. So we can start with that, to kind of, debunk that, or to decrease, to lessen that burden on them, to know that that service should be available to them at no cost. Also by, offering, if they call that facility, to record in their language a message that tells them that, again, that services are available in their language and how to access those services. And also being proactive in writing down in their chart or in somewhere in their, in our system, that what language does that client or that patient or that individual feels most comfortable to be spoken in. What language do they prefer, information to be delivered to them in what language as well. In addition to as well, like, was mentioned the data that was shared by Eddie, what region are they from? What ethnic group do they belong to? So that we can match that, that client or that patient with the correct interpreter, especially since we're seeing a big growth from different ethnic regions, specifically, and we're talking about Mexico or other, parts of the world. We want to make sure that, there's a lot of variance in our languages. So we want to be able to match the correct language group with that individual, so that we're not losing time in matching that, that language group as well. Again, just, thinking outside the box, and again, being creative and asking our populations and our, in our ethnic groups, how else can we, make our populations feel welcomed, right? What are we doing? Are we doing enough to make sure that we are being inclusive in that regard? And again, in documenting, what is a preferred language or linguistic variant that they feel comfortable with and what they do identify with. And again, also too, considering literacy. Right. I know we live in a high-tech society now. What are the tech concerns for our communities as well, for the clients or the, the patients that we're serving? What do we need to consider in that regard as well? And also too, making sure that we're following, throughout that journey of that client or that patient, not just for that one, appointment, right? But throughout the life of the case or the life of that appointment, at every point of contact with that patient. We want to make sure that we are meeting the needs, the communication needs of that patient or that client at every moment, right? Not for that one time only. Next slide, please. Another thing to know, again, it's important to understand, the role of that interpreter, right? That individual that is helping us bridge that language barrier with our clients. Again, the interpreter there, it can be, again, that's individual that's going to help us bridge, who conveys that, transmit that spoken message from one language to another. And their role is to do it with as little omission, addition, or editing, right? They're not going to change that message. They're also going to make sure that they are transmitting the tone and the spirit of that message. So it's important to make sure that we are, again, speaking at a very moderate pace so that they can make sure that they maintain that accuracy, right? As individuals that we're using that individual to help that. And again, the purpose of that individual that's helping us convey or communicate with an individual who doesn't speak the same language as us, again, is to facilitate that direct communication between two individuals who don't speak the same language as we do, right? And again, that interpreter is there for everyone in that encounter. So we have to be mindful of that. So very important that we make sure that we, know that, we have to keep a moderate pace. But again, that interpreter is there is to be able to do that without adding or taking away anything from that encounter. Okay, next slide. And we know many times when trained interpreters are not available, a lot of that burden does fall on individuals that are not trained or ad hoc interpreters, right? So these are, again, bilingual individuals who have well intentions, or but again have no formal training of any sort. And a lot of times this burden has fallen, or still does fall, on untrained bilingual staff, or the clients or patients' friends or relatives. But again, by using family members or friends to interpret, this can create a potential conflict of interest. And it does potentially lead to jeopardizing accuracy and most definitely confidentiality in many cases, right? And definitely when we use minors or minor children, that can definitely also become an issue as well. We definitely discourage the use of children, and even in emergency situations, we have to be careful that we're not using, because again, we're exposing children to situations where, they are being, exposed to various situations where it can be very traumatic for a child to interpret. For a parent, for example, there are situations that just are not appropriate, or they don't have the terminology to be able to grasp the concepts that are needed, to convey the information over accurately or completely at that point. So we have to be careful that we're not exposing them to undue trauma at any point, or when there is another alternative available to them as well, right? So it's very important that we, if we're going to use children, for example, it's only used, in limited situations, only to gather basic information or to convey, for example, the language that's needed, or to just gather basic information to be able to get an interpreter for that particular appointment, in that case or not. Okay, next slide. So we know that, again, interpreters, in order to convey the message over accurately and completely, interpreting needs a very specialized skill and knowledge in order to do that job effectively. We know that, again, interpreters need to have proficiency in both languages in order to convey the message. Interpreters, again, there's a lot of information coming and going. So that needs to be processed very quickly, right? In order to be able to convert into languages, you need to be able to retain that information long enough to be able to convert it over. You need to concentrate, especially when there's a lot of things going on, a lot of distractions. That might be hard if you're not trained to do so properly. Again, you have to be able to listen effectively, especially when you're having to, different modes of interpreting, when you have to convert in real time. That can be challenging as well. You have to be able to articulate. If you're not a native speaker, if you didn't, grow up speaking the language, you're not going to be able to know how to conjugate the verb correctly. And again, there's also, ethics that you have to follow, confidentiality. How do you maintain that neutrality, right? How do you not get personally involved with the information? All those different standards that you have to maintain. How do you maintain that first person voice etiquette as well? How do you know all that, that medical technicality, the medical vocabulary that you have to know? What mode of interpreting do you have to utilize? The different ethics and policies that you have to follow. All these different things, you have to, they have to be studied. Somebody who doesn't have that proper training is not going to have all these things that are necessary to be able to carry this out. This is something that, again, trained medical interpreters need to kind of have, and somebody who doesn't have the proper training is not able to go to implement, and does have an impact, how the delivery of the messages is done, and can have an overall impact in terms of how the, the delivery of the messages is taken in moving forward. So definitely is encouraged, that when we're talking about interpretation and translation services, that it should be done by those individuals that have acquired and have received the proper training in doing so. Okay, next slide. As mentioned too, again, some, interpreters do have to follow a code of ethics that is very important, especially in the healthcare setting and also in the legal setting as well. One of the key factors in talking about that, again, is the confidentiality. Interpreters that have proper training know that, again, they must maintain all the information that is conveyed in an encounter as confidential at all times. They know that whatever is shared within that encounter stays within that encounter, and it's not, they are bound by HIPAA and, patient privacy rights. Again, they know that they have to maintain a level of competency, as I mentioned earlier, right? Professionalism as well. They know that they have to maintain the accuracy of the message. They know that they can't add anything, they can't omit anything, they can't change that message. They also have to maintain the tone, the spirit, because all that has meaning, right? They also have to know that they have to remain impartial, neutral. They may have not, they have no stake in the outcome, right? They don't take sides. And because again, they are there for everyone during the encounter. And they have, again, no perceived conflict of interest. They maintain that neutrality, which may be a little bit harder if you have like a family member or a friend who is doing the interpretation, or even a staff member, for example, who might be doing the interpretation at any given point or not. Okay, next slide. And again, interpreting, it's delivered in various modes. But the most common mode of interpreting in healthcare settings or in most is consecutive, also known as relay interpreting, or, again, where the speaker pauses while the interpreter, relays the message, which is, again, it's the least confusing because, again, only one person speaks at a time. Simultaneous interpreting, you have the interpreters speaking almost in real time. Like I mentioned earlier, we have the interpreters here during this presentation. So only speaking a couple of seconds behind the speaker, and they use the equipment, the headsets, many times. You also have sight translation, which again is the oral rendition of a written document, many times needed in healthcare settings because, again, a lot of vital documents that our communities have to maybe sign or are given as educational materials are not translated in the various languages that our communities need. And then you have the relay interpreting, which is here when two or more languages are needed because you have interpreters working in a team because, again, you have more than one language, a lot of times needed because of our indigenous languages. You have, for example, you have a Mixteco speaking, patient who only speaks Mixteco, and then you would have to have a Spanish-speaking interpreter who speaks Mixteco and Spanish, and then from there maybe to English. So you would need two teams of interpreters to be able to convey and relay that message over, to be able to have, the message relayed over as well. And then you have different modalities, right, in which you are able to have that message delivered. You have on-site interpreting, in which you have in-person, people relaying the message. You can also have over the phone. You can have, now with technology, you also have video remote interpreting, and then video interpreting, and then you also have remote interpreting simultaneously as well. That's available to bridge the language barrier, which is great. With, all these modes are able to connect us and allow us to be able to engage effectively via multiple languages. Okay, next slide. So one of the things, again, just to kind of wrap up my section here is to start thinking about, how do we interact, with interpretation services, and how do we implement this to be able to support our communities moving forward? So start thinking about that. So one of the things that we can do, again, is start thinking about, if I am going to use an interpreter, where do I start? One is making that language or variant check. If I am going to, meet with a client or a patient, start from the beginning, by, even before I start the session, just talk about, what languages or what language will I be needing if I am going to be meeting with a client? Do I need an interpreter, right? What language will I be using? And if I am going to use an interpreter, again, how do I best support this interpreter? One is by providing as much information as I can to that interpreter, materials that he or she can prepare in advance, right, for that encounter. So they can look up the materials, look at the vocabulary so that they can be best prepared. That will be beneficial, definitely 100%. Again, before starting, have a brief discussion with that interpreter, give some guidelines, talk about confidentiality or any other issues that need to be brought up if needed. Definitely, allow that interpreter if needed to take notes, if they have to. Talk directly to my patient or client if needed, right? Speak in the first person voice. if I'm, with my provider, knowing how challenging it is for that interpreter to relay the information, make sure that I'm taking pauses, speaking in 1 or 2 sentences. I know this will allow the interpreter to be able to convey the message over accurately and completely, right? This will help facilitate a better communication between myself and that client or that patient. Making sure that I'm making frequent check-ins to ensure for clarification and understanding, right? To make sure if there's any additional information that I need to provide, for that as well. Making sure that I'm not having side conversations, right? Or, contributing to miscommunication or misunderstandings as well. And then again, making sure that I'm providing enough breaks, because again, it can be very taxing, especially when we're doing simultaneous, interpretation. It can be very, fatiguing for the voice as well. And again, if I have to also do a debriefing, making sure, that I check in and making sure that I, find out what worked, what didn't work, what can be done differently for the next time, so that I can support that interpreter, and then also making sure if there's anything we can do differently for the future, right? So that we can enhance and improve, the outcomes and support both our clients that are LEP, and then again, the interpreters and translators that are doing this job for us to be able to help us bridge those language barriers moving forward. Okay, next slide. Right. So again, I guess, we'll go ahead and open it up. Is there any questions at this point?
Yeah, thank you, Mireya. Yes, there are quite a few questions.
Okay.
We have limited time. Let's pick an easy one, and you can answer them in the QA box.
Great.
Sheeny Chow has a question. If an interpreter does not have an US diploma or college degree, can they still enroll or accept into interpreter program or course?
Yeah, so it depends on depending on the different schools, they can go ahead and depending on where they want to apply. A lot of schools will look at and they will validate what schooling that they do have. So I guess it depends on each, where they want to apply. But I know that a lot of different schools, for example, the Commission on Certification for Medical Interpreters, will look at and they will revalidate some of their from their home countries.
Yes, thank you so much, Peter. Yeah, well, I hope you get to answer some of the questions in the Q&A box. So let's move to the next slide. I would like to invite Joanne from LAFLA to talk about language access in different settings.
Great, thank you for having me here. I know that there's been a lot of great material covered, especially around general language rights, as well as just more practical information that we all have to know. And it's been focused in the health context, but I wanted to also share some others on the next slide. You'll see this is definitely not an exhaustive list, but there are many, many statutes, regulations, guidance documents that touch upon the prohibition of discrimination on the basis of national origin, as well as other statutes, regulations, and guidance that specifically prescribe requirements around the provision of language services. So you'll see here the first couple I listed because we do want to recognize that sign languages are covered in many of the disability protections, some of which are tied to whether the entity receives government funding, but it's also important to note that the Americans with Disability Act does not require that link to government funding and is much broader. So in some ways, the disability protections can be seen as stronger. I know we're not focusing on that here, but I did want to mention that we sometimes do use those tools in the legal context as well, even though in the language justice community, we do recognize sign languages as distinct linguistic groups and communities and not as a disability. I also wanted to note some of these other statutes here in other sectors such as housing, law enforcement, employment. There's a Food Stamp Act that specifically talks about requirements around language services. We see them in the context of voting rights. Also within the state of California, we have specific statutes that also cover fair employment and housing. the UNRWA Civil Rights Act covers a wide range of both private and public sectors. And then we also see even more statutes in the unemployment context, the evidence code that relates to interpreters in the courts, other election code sections, as well as civil code that covers translations of contracts in certain contexts. So that's just sort of a snapshot and overview. I also wanted to mention that the right to getting language services is a right in the civil rights context that is an individual right. They are not rights that are activated only if there are a certain number of people. The way that services are provided may differ, but each individual is entitled to meaningful linguistic access. And so if you go to the next slide, you'll see when we talk about what is meaningful language access, there are many, many elements. Darina touched upon it earlier, you know, those elements that have to be in the language access plans. These are all various ways that we put together in a holistic way that require actually a very high level of meaningful access. It can vary a bit based on industry or the type of service or benefit offered, or even the language group. But these sort of guidance documents and laws are quite expansive, and there is a lot of confusion about what is required, and we often see a lot of non-compliance or under-compliance. But we really have to look at sort of, you know, what we call a patchwork of these different statutes, regulations, guidance documents, there's memos, case law, to see what is entailed in meaningful access. And so you see here that we see, you know, it's not just about interpreting or providing translations. There was a question in the chat about what we can advocate for beyond just those two things. That was a great question. And we really want to take this holistic approach where we think about language access from the very start. When you are planning any program or initiative, it cannot be an afterthought. You have to think about it from the planning stages. You have to make sure you have responsible staff, that you're engaging with communities, that you're collecting language needs early and throughout the life of the case, that you are looking at data. Who are you serving? Who are you not serving? Looking at that both externally and internally. You know, are you training your staff? You know, that goes to Maria's presentation. Are we making sure that we're not relying on machine translation or AI tools, which I'll get to in a moment? Do you have specific protocols for languages that are emerging or have been historically isolated, or are of lesser diffusion, or maybe don't have a commonly used written format? So there's not just one approach for every community. We have to make sure we are considering all of these different needs. Are we providing notice? Are we doing outreach, staff training, making sure there's budgeting, oversight and monitoring? We'll get to the complaint process later. And then just being strategic about how you're evaluating and really creating systemic change within your programs. So we really want to take this approach when we think about what is language access. On the next couple slides, and I'll go through quickly because I know we're a little behind, but I wanted to look at this issue of machine translation and the use of AI. It is something that I know we're all, you know, seeing advancing very, very quickly, but it is not at the point where it can be used alone without human review. Both Darina and Maria mentioned that in their presentations. Of course, these are wonderful tools. We want to embrace technology however we can for professionals. Those of us who may be bilingual, we do use them as for ideas, for starting points, but then do significant review and editing. And so many experts in the field have cautioned against using these automated tools without human review. Here is a message from the American Translators Association with I thought was a fitting analogy with Alexa. So perhaps you can use it for inconsequential interactions, but not you know, for medical or legal interactions. Sometimes Alexa can, you know, answer your question, you know, quite accurately, and other times it's way off and completely nonsensical. And we know that our community members who are linguistically marginalized have reported to us that they are less likely to trust sources and entities using these types of tools. And we think about all of the care that we put into, crafting our messages in English, and then we just let an automated tool create it in another language where the content could not only be inaccurate, but also the tone and the register could be offensive. These are already communities that don't trust a lot of government entities. So why would we risk all that? So definitely not something we should be doing within our own organizations. And we definitely want to advocate that, that government entities that we interface with don't use it as well. We have seen the harm on the next slide. You'll see an example from the Virginia Department of Health that used Google Translate for Spanish, letting folks know that the vaccine during the pandemic was not required, and it came out as saying the vaccine is not necessary. So it created a lot of harm within communities that were already mistrustful, and this was literally a matter of life and death. Here in California, on the next slide, there is an example with an emergency rental relief program that the button for back said, "Go back to your country, applicant," after using Google Translate. And, as advocates, we have advocated for clear safeguards with various local and state agencies and departments in California, but we also see a lot of guidance from the federal government. On the next slide, and Dorina mentioned this as well, we saw it for the first time in federal regulations. HHS put out a provision that said the translations had to be reviewed by qualified human translators. The Department of Justice also had a similar safeguard, and then also HHS in their language access plan. The federal government has done a lot on this, and we hope that these will be implemented and adopted by our local and state governments as well, especially where critical benefits and services are being provided to our most vulnerable communities. So with that, I think my portion is done, but I'm gonna either pass it back to Eddie or Heng Lam.
Yeah, thank you. Thank you so much, Joanne. There are still a lot of questions around interpreters, but if you have any questions, folks, please feel free to use the Q&A for Joanne. And if not, let's pass it to, I want to pass it to Heng Lam at API for Movement to show you how we can improve the language access.
Thank you, Eddie, Joanne, Mireya, and Dorina. Monique, may I have the next slide, please? My name is Heng Lam Phong. I'm with API Forward Movement. The next few slides will go over the whys and how does this look like being implemented on the ground, right? Because often language access policies could be in place, but any good policy must be monitored and implemented properly. So I put forth that all of us in the space have the responsibility, right, to ensure that language access actually happens. We've heard about Title VI, right, Government Code 11135, so on and so forth. But why? Truly, why is language access important? Right? It's because that everyone has the right to be able to participate in their community, right? In a meaningful way, if language access is ensured, right? It is a human right. People have the right to be free from discrimination, to speak a language that they speak, and to be able to maintain these languages, to keep it in perpetuity and pass them on to future generations. We also hope that everyone in the space, right, understands that having the right to language is to be sure that whatever language we speak is valued and respected. Next slide, please. Joanne, I think, did a great job talking about best practices and what to look for in provider locations. So we're going to skip this slide in the interest of time. Let's pass this one. And I just show you some images of what language ID posters or I Speak cards can look like. So to the left, you'll see an image that I found on the website of the city of Oakland. It talks about, it actually shares, right? You have the right to really ask for an interpreter at no cost to you, and they do this in 8 of the dominant languages that is served by the city. To the right is one sample, and I know more are being created, including by Asian Resources, Inc., ARI, and I Speak Card. Often, if individuals who are limited English proficient or LEP do not have the ability to ask for an interpreter, an I Speak card can be helpful, right, to identify the language, or a poster to the left where people can point to the language and remind the provider, not just in health, right? It could be in a benefits office, that an interpreter is being requested and that the provider should note the primary language need inside the case file. So just 2 examples in terms of the images on this page. Next slide, please. So the next 4 slides, the 4th one will be interactive, asking you for your input, but I wanted to give you some real life examples on how language access has been asked for and how advocates have used different tools, right, to ensure that it is provided to the individual. This first example here, and I apologize for all the text. The first example here is at a family serving healthcare facility. So this is healthcare focus, right, of a family from Zapotec who speaks the indigenous language and was trying to access services for 2 children. So dad had asked for a Zapoteco interpreter, but the hospital kept offering Spanish-speaking interpreters for his children's appointments, right? Insisting that he speaks Spanish. And sometimes there was no interpreter available at all. So what are the challenges, right? You are removing meaningful engagement for the family with a Spanish language interpreter interpreting for this indigenous language. Dad and the 2 children are unable to develop any kind of a patient-provider relationship. In insisting that the family speak Spanish, that's a tremendous lack of cultural humility from the providers. And if the family does not know how to care for the children, right, it causes stress, anxiety, and fear. So what happened? So dad worked with some language access advocates to write a letter to the hospital's patient relations department, a simple letter indicating that he is concerned. This is a language that he speaks. It's not been receiving interpreters in the language. Unfortunately, the hospital took very minimal action. So after monitoring it for several months, the advocates eventually filed a civil rights administrative complaint, and the U.S. Department of Health and Human Services initiated an investigation compelling the hospital to offer the appropriate language services and improve their internal practices. So there is a recourse if people who are LEP, people who are affected by the lack of language access services are supported, right, by advocates who know how to implement these tools and understand how to interpret the laws and requirements that Dorina and Joanne had explained. Next slide, please. The next example is one from where I work, right? APIFM works with Samoan and Tongan communities to increase access to health and nutrition programs, including CalFresh enrollment, we distribute produce and offer health access navigation, right? So some access barriers that we've seen is that we need to have bilingual, bicultural staff. So we hired bilingual, bicultural navigators or community health workers. We needed to develop in-language materials and also address some cultural competency and distrust that the community has for Western institutions and medicine. So there's never a perfect, foolproof language access plan that anyone can develop. But in this case, right, the possible solutions that we had to think about is the hiring of staff, We created relationships and nurtured relationships with faith-based organizations, right? Really a safe community space for the community. We developed partnerships with clinics, right, to help navigate and understand what kind of services can be offered. And the picture on the left is a picture of some of our community health workers visiting a clinic in the South Bay. So trying to connect community to these sites, but by first developing these relationships. Culturally relevant materials don't always have to be translated unless the community speaks and reads in that language. But the image to your right is really using this bingo card format, right, to talk about CalFresh education and outreach. Bingo is a game that's really very highly used and recognized within the Samoan and the Tongan community. Some churches have bingo nights. So employing a culturally recognized tool and adapting it to make it an outreach and education tool, in this case for CalFresh, right? So a small example of what's being done in this particular community. Next slide, please. This example talks about how all of us can really advocate for county government or funders, right? Many nonprofits get money from the government and from private foundations and elsewhere to do the work that we do, right? So how do you convince people who give out money to think about language access? In this case, it is with the LA County Regional Park and Open Space District, RPOSD. They administer Measure A funding from 2016 called the LA County Safe, Clean Neighborhood Parks, Beaches. And what this funding does is it builds parks in park poor communities. It offers job development for youth. So there are multiple avenues that it kind of dispenses funding into the community. So what advocates actually did was champion the inclusion of language access requirements in the RFP, right? It's like asking a funder. If you're funding someone to do work in a community that has a high number of LEP community members, can they tie that funding to a requirement? So this particular funding stream required that proposals that are submitted for funding must have a budget for language services. The applicant must do some language access verification and demonstrate that outreach methods use current data, right? And there is a plan that the applicant must demonstrate to engage with people in the community that speak different languages. And there are 3 tiers that are prescribed in this manual for the dominant languages in the community. And I'll show you an example of what it looks like. Next slide, please. Thank you. So this is the grant administration manual. I know the images are small, but you can actually look this up. There's a link on this page. So the grants administration manual for Measure A has an appendix in it called Appendix C that shows you 3 tiers of language access requirements. Tier 1, if there's a high number of the community that speaks the language. Tier 2, to a smaller degree, and Tier 3, to the smallest degree of population speaking that language. That's the image in the middle. The image on the right is actually an outline. If you look at this manual, it outlines language tiers for all 88 cities within the county. For example, if you're looking at this, right, for Montebello, Tier 1 language is Spanish. For Monterey Park, Tier 1 language is Chinese, followed by Spanish in Tier 2 and Japanese and Vietnamese in Tier 3, right? So the point of sharing this with you is that we can all think of how we get people who give out money to think about language access requirements. Next slide, please. Okay, so this is another example that we're seeing on the ground, and I'd love to hear from you in terms of what you would do if you lived in this community and you're working with the senior center, right? So this example is about language barriers at a city-operated senior center, right? While the center serves a significant population, right, over 90% of LEP Chinese-speaking seniors, they've been unable to offer consistent language services. So community members who go there, as well as service providers who offer services there within the center, have just found that there's a lack of bilingual staff, right, at the front desk and elsewhere. There's a lack of translated materials, so signage around the center is not translated. And there is no sign that indicates that you have the right to ask for an interpreter. Staff have been reported using Google Translate to communicate, right? To not have an interpreter, but using Google Translate and raising their voices when they talk to people who are LEP, right? Delaying and really offering inadequate and meaningful communication. And we know the city has a language access policy that's outdated and that the staff lack specific protocols for providing language assistance to their LEP constituents. So this is what's happening. Next slide, please. All of this, what's the impact, right? Older adults that go there struggle to access vital programs and resources, right? Putting them at greater risk of missing out on essential services, right? And worsening their health and social disparities. What possible solutions would you propose to solve these challenges? We'll give you a minute to put that into the chat boxes. That is it for this part of the presentation. Really just meant to show you what you can do, right? And what you can expect on the ground. I'm passing it back to Joanne and Dorina for the next section. And please continue to put your possible solutions into the chat box. Thank you.
Thank you, Hang Lam. So that was a great segue, because now we're going to talk about possible advocacy paths. And so if we go to the next slide, we're going to talk about lots of different avenues. But I think what many of us start with are just setting up meetings, right? We meet with different agencies, different work groups. One example, Dorina mentioned that in LA, in both the city and county, there are efforts to strengthen language rights, language access within city and county departments. And so as those plans are being developed, as practices are being rolled out and implemented, we have been trying to meet regularly with the leadership within both the city and the county, overseeing that process to make sure that you know, our voices, you know, the experiences of our community members are being included. So that is something that is ongoing. We are, you know, trying to engage as much as possible. We are trying to review documents, provide, you know, lists of priorities, things like that, and also trying to be involved even in things like the budget process where we can. We're also trying to do that statewide with various departments and agencies. And so, you know, that can have varying degrees of success. And obviously, if this doesn't work, then we move on to a more sort of assertive approach. So on the next slide, you'll see a lot of language rights advocacy does go through the administrative complaint process. So there is a process for that, both in federally and statewide, which will be covered later, but this is just sort of an overview of the federal process. If you go to lep.gov, there's a lot on how you can file complaints with various federal agencies depending on the sector. Here we put as an example the U.S. Department of Health and Human Services, which is the entity, the department where we filed the complaint for the Zapoteco speaking family. It can be filed in writing by mail, fax, email, through the portal online. We also have, you know, a lot of the advocates do have contacts at these various agencies, and sometimes we can just reach out to them to talk about specific issues. They are also willing to provide technical assistance to entities, like before we get to the point of filing a complaint. So that is also another strategy. And, you know, these can be filed for individual issues like the one that we shared before, where, you know, you're just trying to improve something for, you know, one family. Obviously, we try to do it more systemically, and sometimes we will be a lot more strategic about, how we build up to that complaint, the kind of media outreach we do, how we let people know about it, and then the relief, whether it's for the individual or for the public interest. So it can be a broad range of things, really depending on what the patient or the client wants. We might do it based on, whether they're willing to, what they're willing to do. So, and sometimes we have filed these on as an organization, because our resources are being taken away, because we are having to provide the language services. So if individuals are reluctant to be named, there's different ways around that as well. So I'm going to turn it back to Heng Lam to talk about a very specific example of a complaint that was filed with the U.S. Department of Health and Human Services Office for Civil Rights.
Thanks, Joanne. I'm taking this slide because this was a complaint that we filed on behalf of a patient many years ago. And I wanted to share some of their voices here in italics at the bottom, right? We worked for 3 years to try and get multiple county hospitals to offer interpreters to these patients that they were treating. And it is just absolutely unacceptable to have a 16-year-old girl tell her mom that she has stage 4 cancer, right? It's unacceptable for a stroke patient to not be able to get an interpreter so he can recover. It's unacceptable to have the son of another patient interpret for a woman who's getting a GYN exam, even though it's behind a curtain. It's all unacceptable, right? So we did not want to file this complaint, but it was just year after year of meeting with hospital administrators, right? With the director of the department. Nothing worked. So we worked with language access advocates, right, from the National Health Law Program and Asian Pacific American Legal Center, that's what they were called back then, to really figure out what we would do. So we completed a form. You can write a letter, fill out a form, contacted the Office for Civil Rights in Region 9 and put this in. So they investigated, and the county volunteered to negotiate an agreement. So the resolution agreement was completed. This whole process took a year to negotiate because county council got involved. OCR was at the table. They would communicate with us. We needed to look at the language. So all county medical facilities have to post language ID posters. We helped with the development of that and looked at what the posters look like. Translation of documents required in a minimum of 6 languages. Staff had to be trained on how to work with limited English proficient patients, right? There was testing and training of their bilingual staff that needed to happen. And an annual in-service for staff on how you work with, how you offer customer service to the community, right? We're all service providers. We have to be able to offer care that is meaningful. So annual in-service training and appointing a senior level employee who would oversee this at each medical facility. So that was what's in the resolution agreement, which is that document after a complaint that brings the 2 sides together to come to an agreement of what this plan is going to look like. Passing it back to Joanne.
Oh, I think
Dorina.
I think perhaps it's me, Heng Lam.
I'm
So
sorry,
thank you.
Dorina. Back to Dorina.
No problem. But so I'm just going to just go on to suggest some different advocacy strategies, beyond the federal level, because there is a similar process at the state level where you can file administrative complaints. The primary enforcement agency for that government civil rights code that we mentioned, 11135, is the Civil Rights Department, where you can actually file a similar complaint using, you can do it by mail using an intake form. You can call the number here on the slide or online. Similar process to the federal OCR complaint process. And similarly, each agency like CalHHS, probably in each of its departments and offices also has a complaint process internally that you can try to look up to file the complaint. So depending on which agency or office it is, you can file a complaint with that specific agency. And then also, in terms of healthcare providers, most hospitals and clinics have a grievance procedure as well, or complaint process. Of course, you can, complain and ask for your language assistant and interpreter or translated materials. And if they don't, then you can go ahead and file an actual complaint with the facility. Next slide. So there's different additional advocacy strategies that we wanted to quickly share with you. Besides the administrative advocacy, there's what we call legislative advocacy, right? That's when you try to create or amend laws to address the gaps and inequities, right? Where advocates directly engage with lawmakers. They could draft a potential bill, attend hearings, and provide testimony, and work in coalition with other groups to try to push through a bill to create new rights and protections and services for entire LEP populations. And so, well, in just a moment, I'll go through an example of this. But you can also do some budget advocacy. That is because a lot of times the agency might say, oh, we don't have enough funding for this. So you can make sure that there's enough funding for your policy priorities. Maybe to fund your bill or specific program. And then also, you can always file a lawsuit. There's always litigation, that focuses on going to court to enforce the laws and regulations, either through Title VI, or the government code. But of course, lawsuits require a lot of resources and attorneys to help out. But it is an option. It usually takes a while, a little longer. And you can also embark on like a media or or public education campaign, right? Where you can focus on using the media, including social media, to get a reporter or a media outlet to publish an article and share, a sympathetic client story to garner support for a specific issue or a campaign. And then finally, of course, it's important to provide community organizing in any of these efforts and try to involve and empower the community members to educate the public and the public officials to get support for your policy effort or campaign. So the next slide, please. As I mentioned, we just wanted to include here for your reference. There was an effort where we, this last year, some CBOs, 5 CBOs, including ARI, sponsored SB 1078 to create an Office of Language Access at the CalHHS agency. And so we wanted just to codify what they were already doing, supposedly. It would provide a central coordinating role for this particular office. And it provided some more specifics around what the Language Access Plan would do and what the Office of Language Access would do. Much more specific requirements and more transparency and accountability, right? For for instance, there would be a public website where the office would share their information and resources. There would be a language access advocacy work group. And actually, we had a provision where any language population could request the translation of written documents. So these were all an effort to try to ensure that the efforts that the CalHHS was doing would be permanent. Unfortunately, it made its way almost through the legislature until the last committee, the Assembly Appropriations Committee, which it did not get through. But through that momentum, and probably thanks to a lot of you on the call here, we got over 100 letters of support, a lot of people to support this effort and testify in support. So we're taking that momentum and trying now to continue in terms of some administrative advocacy with CalHHS to make sure that some of the requirements that we were advocating for will be part of their language access plan. Next slide. So then we wanted to just make sure that you knew where to get help if you didn't receive the language assistance services that you needed. I'm not going to go through all of these because we're running out of time, but you will see that it depends on which agency you're going to you're interested in, whether it's a federal fund recipient and you might go to OCR, whether it's a California agency, you might go to the Civil Rights Department. But as you will see, there's different suggested places. This is a managed care plan. You might go to the managed care plan, the Department of Managed Healthcare, the next slide. And then on this last slide, you will see that there's different offices of Ombudsman for Medi-Cal, Cover California. And I did want to just mention the Health Consumer Alliance, because that is a network of legal services advocates that can help consumers either get their language services or file, complaints as well. And of course, any of our agencies, including ARI, have our contact information here. So that ends our conclusion of our webinar. I'm going to turn it back over to Eddie.
Yes, yeah. Hi, please, Chuck. Yeah, move one more slide, please. Thank you, folks, for staying a little bit longer. Apologies for this going a little bit long. We have a few more minutes, so just want to make sure that you have access to all of the different requirements that we mentioned. Once you have it, you should be able to click on, you have the webinar recording and slides. You should be able to click on these and take you to the actual policies. And next slide, please. And we want to highlight that LAFLA and also with the API, I think gender-based violence, created a organization language justice assessment tools that you can use to assess how your organization is doing around language access. Next slide, please. And that the previous one has English and Spanish material. And these are the material that ARI is finalizing and has already created, available in English and Spanish. One of them is the federal and state resource flyer, which is on the right-hand side of it. That's where we will share information with you how to find help in your language and the different popular resources that we usually use. And there is an I Speak card that's ready for you to use, also available in English and Spanish. And it will be a card that clients can carry around and let people know what language they speak and how they can help them. And then lastly, there will be a how to get information. Oh no, yeah, how to get information in your language, which is like a fact sheets that clients can use or we can provide at our different events, so people can take it with them and let their doctors or public services provider know what are the laws and regulation around language access. I would want to bring Oscar in if Oscar wants to talk about helpful resources and the evaluation.
Yeah, thank you so much, Eddie. I'll breeze through this as quickly as I can. I know y'all got things you got to do, places you got to be. Some quick additional resources. Again, this webinar was helped put on in partnership with the California Protecting Immigrant Families Coalition. We've developed quite a variety of materials around webinars, recordings of past trainings, service provider modules, and we've all kind of compiled them on one site. It's on CPCA, or the California Primary Care Association's website. There's a QR code on the top right corner that you can scan. It'll take you to the resources that our work group has created over the years. On the bottom right, we have something that's called All In for Health. It's a project of the Children's Partnership, and this particular QR code takes you to the Immigrant Resources page. That particular part of our website has information regarding the recent Medi-Cal expansion. It has a pamphlet that helps support or trains folks on queer and transgender immigrant health, and also has information around public charge as well. So you can scan that bottom right corner as well. It's on allinforhealth.com. And again, these will be sent out to you afterwards. Can you click us forward, please? Yeah, so these are 3 of the new fact sheets that All In and the California PIP Coalition helped create. You'll see these on the website. On the left, we have a health coverage roadmap fact sheet, which gives you the steps to actually enroll in Medi-Cal, find services, renew your coverage. We have all of these fact sheets are available in 7 different languages. And they're all available on the website. In the middle, you have the immigrant health coverage. This explains the Medi-Cal expansion, basically announcing that as of this year, all folks in California, regardless of immigration status or age, are eligible for Medi-Cal as long as they meet the income requirements. And on the right, we have our public charge roadmap. So this essentially gives the most recent update to the public charge rule and essentially gives folks who are applying for family-based green cards some guidance on what are some public benefits that do or don't count towards your public charge. And again, these are all on the website, 7 different languages. Can you please click us forward, Monique? If you want to download electronic versions of these fact sheets, we also have social media templates to share them with your networks. We have an educator toolkit if you'd like to share this with your school, your child's school, or the school that you work at. Our All In for Health project is specifically made to partner with educators to share health coverage information with students and families. So again, you can use this QR code to find it. All of our content's in English, Spanish, Punjabi, Tagalog, traditional Chinese, Vietnamese, Haitian, Creole, and Korean. And click us forward, please. Some additional resources that, again, you will get this in the follow-up email. We have information about contractors that provide immigration services. The county that California provided a list of different public charge providers, a list of pro bono legal services, information regarding the Health Consumer Alliance, which can help with advocacy and filing complaints, the All In for Health website that I mentioned, as well as keepyourbenefits.com, which is a great resource for immigrant families and information regarding what public resources are or public programs are available to them. Just really quickly, our contact information for folks that presented today. Again, if you're interested in having any of us or organizations come present to your organizations, please note down our contact information. We know this information is valuable. We didn't get to cover it all with as much depth as we wanted to. So we'd love to have follow-up conversations with all of you. So please note this. Again, this will be shared. And then we'll click us to our last slide. Thank you again for sticking with us. Please, if you can, scan this QR code to complete the evaluation. This feedback is incredibly valuable for us to design more effective evaluations, as well as for some of the grants that we receive to put these programs on. So right now, Eddie is dropping the link to the survey in the chat. You can also use the QR code if you'd like to use it on your phone. The survey is translated as in English and in Spanish, and we'll also send out the survey link in the follow-up email as well. So if you're not able to get to it in this particular moment, you'll still have a chance to complete it. Again, we really appreciate y'all taking the time to submit this for us. It really helps guide our work. And then we'll go to our last slide. Last but not least, especially given the topics of today, we'd like to give a shout out to Local Lipsum, the organization that will be translating these slides. You will be getting a Spanish version of these slides in your email as well. So shout out to them, as well as to our interpreting team. Edna and Julie, they were our wonderful interpreters today. Their information is there as well if you're looking for interpretation services. And Eddie, do you want to go over any of the funding acknowledgements?
Yeah, thank you, Oscar. I want to go back to the evaluation. Do they still get, are we still planning to do the raffles or something?
My apologies, yes. Most important part, for folks that submit the evaluation, you will be entered into a raffle to win a $50 gift card. We'll have 4 of them that will be given out. So again, we're super grateful for your feedback and would like to reward y'all for helping us out. So thank you for that reminder, Eddie. Yeah, we will also send a note when we send the evaluation to you. Yes, yeah. Lastly, just do a funding acknowledgement. The training is funded by California Community Foundations, CCF, CareQuest Institute for Oral Health, and $375,000 award from the U.S. Department of Health and Human Services, Office of Minority Health. And the contents do not necessarily reflect the official views or endorsement of OMH, HHS, CCF, and CareQuest. And thank you so much all. Thank you for the interpreter. Thank you for people who stick around. And we will send out the recording and the slides, as well as a document of all the question and answers to you all. And you will have all the information that you need. And you also have our contact information. So if any time you have any additional questions, please send them our way. And thank you so much. And I hope you have a great rest of your week. We will stick around in case you have any questions.